here's our agenda. We'll review some of your benefits. We'll look at upcoming events. We'll have Rutali present her research and resources that she helped the Center for Health Design create on infection prevention. And then I will actually review some of our resources related to that. So of course, one of our goals here today is just to give you a quick reminder of all of the benefits you have access to as a member, and also recognizing that based on your requirements, everyone has perhaps a slightly different level of membership access. So some of the resources you'll see today are at the Affiliate Plus level, and some of them are at the affiliate level, and I will indicate to you what are the different access points. One of the exciting benefits that has been added recently is our webinar week, which provides access to the webinars for a full week each quarter. So that will happen in August, and I have the dates for you coming up on that. But just make sure that you're taking advantage of your benefits. If you go to the members only page, you need to log in, go to the members only page, then you can take a look at the list of benefits and link directly to all of the different areas that you have access to. But really, it is our goal to provide recognition to you for the work that you're doing in the industry, and also to provide learning and networking events, and of course, to help disseminate and share all of the wonderful research that's going on in our industry. So in terms of specific upcoming events that might be of interest, you see on the left-hand side of the slide the upcoming webinar topics. So on July 11th, for example, the VA Healing Environments and Research. And then I mentioned to you the webinar week. That will take place on the week of August 12th. And all you need to do is log in and you can have access to all of the on-demand webinars. And of course, Affiliate Plus members have access to those webinars anytime. And then in terms of live events, on the right-hand side of the slide, you see we have the Health Design Insights networking events coming up in Chicago and also in New York, and Pebble in Practice workshops the week of September 17th in Baltimore. And then of course the Healthcare Design Conference, where we hope to see all of you in November in New Orleans this year. And you can get more details about all of those events under the events tab on the website, healthdesign.org. And then we are celebrating 10 years with the EDAC certification. Congratulations to all of you who have achieved this certification, which really demonstrates your competency in the evidence-based design process, which has become so important in our industry. And there are thousands of individuals who have achieved this certification throughout the world, and we're very proud and excited to be celebrating 10 years with the EDAC certification. If you're studying now, I wish you great success. And if you want more information, you can always email me after the webinar. And so based on the success of the EDAC certification and the recognition of the importance of the EBD process in the industry, the center has launched the EBD Touchstone Award. And this is a wonderful way to really recognize the accomplishments in that area for specific facility projects. And we do have an informational webinar that takes place about once a month on the submission process. So I mentioned to you that we have some Pebble in Practice live workshop events coming up in Baltimore this fall, and that we'll be covering one day on pediatric settings, one day on behavioral health settings, and one day on the aging mind, all topic areas that are really very important and relevant in our world today. We talked a little bit about the Healthcare Design Conference, so please save the date for that. And just as a side note, the Center for Health Design, this is not the Center for Health Design's conference per se, it's owned by Emerald Exposition, but the Center for Health Design is the education partner. And so many of the center's webinars are presentations that have been given at the Healthcare Design Conference. Our education director looks at the sessions that have been ranked highly and were very popular and invites those speakers to provide those as webinars as a way to really share that insight and education with everyone in our community, both those who were attending and couldn't get to the session or those who were not able to be at the conference. So just keep in mind that the webinars are a great way to get additional access to that education. Okay, so now I have the pleasure of introducing Rutali Joshi. She will be sharing her, these are new resources in our infection prevention toolbox, in which Rutali was a key contributor. And Rutali Joshi, as I mentioned, is a second-year doctoral student in the Architecture and Health program at Clemson University. And I want to tell you a little bit more about her background and her work. It's very impressive. Her doctoral work is supported through the Richard Pennell Fellowship and focuses on understanding the impact of built environment on the physical behavior and health outcomes in emergency departments. And she currently has the privilege of working as a research assistant to Dr. Anjali Joseph for the Center for Health Facilities Design and Testing on several funded projects, such as realized improved patient care through human-centered design in the OR. So with that, let me turn the presentation over to Rutali. Maybe Rutali, we can turn your camera on, and I will thank you so much, and thank you so much for being here. And you can let me know when you would like to advance each of the slides.
Thank you so much for the introduction, Lynn. I'm really honored to have the chance to work with the center and to present to the affiliate audience today. So let me begin by providing you an overview of the presentation. If you can go to the next slide. We will touch upon what's covered in the issue briefs, and I will briefly talk about the epidemiology of pathogens, their transmission in the environment, the nature of these pathogens, and why this knowledge is really necessary to design spaces and to be able to design surfaces and select materials in a healthcare space. Additionally, the issue briefs also will throw light on cleanability of surfaces and some of the current and emerging innovative technologies that are used for cleaning these surfaces and what implications they have on design and specification considerations. As you will see in the next slide, can you move ahead one? Yeah. As per the 2018 CDC statistics, approximately 1 in 31 hospitalized patients in the US have healthcare-acquired infections. They're a major cause for mortality and morbidity, and they translate to huge costs for the healthcare system. HAIs are caused due to these harmful pathogens that persist in the environment. And it's scary because some pathogens, they grow in the environment for days and can stay for even months at times. In the next slide, for example, we have listed some of the most commonly reported pathogens in healthcare environments. C. diff is one of those that persists for a few months and is transmitted through contaminated hands of healthcare workers or patients. Methicillin-resistant Staph aureus, VRE, and some others that you will find more details about in the issue brief are found to last for a few days to even a few months. The transmission of these pathogens occurs through person-to-person contact, air, water, or droplets. But what is really important is that the role of fomites in all of this is sometimes ignored. If you go to the next slide. So this was, this is how we see how pathogens are found on varying surfaces in the environment, like medical equipment, floors, public seating, hand washing sinks, or even tools, and they become the reservoirs of pathogens. Healthcare workers, patients, care partners, they're commonly exposed to these surfaces and can become infected or susceptible hosts or carriers of these pathogens. When the infected carrier transfers pathogens to objects or materials around the patient zone, those surfaces become fomites. Steenberg in 2013 conceptualized the role of healthcare facility design in breaking the chain of contact transmission through various environmental interventions like we can see listed in the next slide. Provision of private rooms to isolate the host and reservoirs, or determining the proximity of patient beds, avoiding shared patient restrooms, or installing hand washing stations at appropriate locations are some that have been discussed in the literature for quite some time now. Hand hygiene has been the primary focus of infection prevention efforts, but surface design and properties are now beginning to gain more attention. Can we go to the next one? In order to be able to design these surfaces to combat infections, it is really necessary to understand how humans interact with these surfaces. What are the characteristics of the pathogens that survive and grow on these surfaces? Cleanability of surfaces, the cleaning approaches that are adopted by healthcare systems. What is the impact of ambient conditions on these, and how operational factors can also contribute to the growth or to the prevention of infection? In the next slide, we'll see that different studies have classified surfaces in the healthcare settings differently based on frequency of touch, proximity to the patient, or even the different types of surfaces that we see. When we talk about frequency of touch, surfaces are classified as high touch, medium touch, or minimal touch. In the next slide, yeah. So frequency of touch is classified as high when there is frequent hand contact, or uh, those which sustain more than 3 contacts per interaction. Bed rails, bed surfaces, supply carts, overbed tables, and IV pumps are all classified as high touch surfaces. Curtains, chair cushions, doorknobs, medical equipment, room sinks, all of these fall under the medium touch category. Floors and ceilings are generally minimal touch. However, in spite of being minimal touch, floors can be high contamination surfaces. Moving on to the types of surfaces, they're classified generally as hard surfaces and soft surfaces. Hard are the ones that are non-porous or impervious in nature. Metal, molded plastic, stone, wood, glass, laminate, all of these fall under the category of hard surfaces. However, sometimes due to damage on the surface, there could be cracks and crevices that make the hard surface a little porous. Soft surfaces are those that are mostly fabrics or textiles that you see in the healthcare setting. They're generally made up of cotton polyester blends, nylon, spandex, all of these. The survival and transmission of microbes on soft surfaces has generally proven to be more complex than that on hard surfaces because of their porous and three-dimensional nature. Approximately 50% of beds and mattresses are contaminated with MRSA. These are soft surfaces in the patient zone. Some soft surfaces are easy to remove and launder. For example, we have pillows, beddings, towels, surgical gowns, privacy curtains or drapes, which are very easy to remove and launder, while there are others which are less so. For example, we have carpets or upholstery and then window drapes, which are really difficult to remove and clean. 100% of the VRE that was found on some of the chairs that's used by care partners could not be disinfected even after cleaning. Some hospitals use disposable materials for extremely high touch soft surfaces like privacy curtains and drapes, while others prefer to wash and reuse materials given ecological and financial constraints. Another important fact that came from the literature was that hospital window sills that could be away or close to the patient are ranked as surfaces with the highest contamination. Next slide. So knowing surfaces in close proximity to the patient, understanding the frequency of surface touch and the level of contamination, it is necessary that we as designers have better understanding of the characteristics of pathogen that adhere to these critical surfaces. For example, rod-shaped cells are retained in high numbers on surfaces with small features due to the alignment with the surface topography. Structurally, for example, the presence of a protein fiber on a cell that could extend from a cell wall and bond to surfaces, or formation of biofilms on dry and wet surfaces. These are things that we need to understand about the pathogen and how they behave. Biofilms in simple languages would be colonies, architectural colonies of microorganisms. What this issue briefs really do is break down some of the scientific terminology, which is really, really difficult for us as designers sometimes to understand. So we break those down into simple language so that it's easier for common people to understand the structural characteristics of pathogens and their mechanisms of existence and survival. Not only does the morphology of pathogens matter so much, but it's even how they react to the environmental conditions and how they thrive in some of them. It is important to be able to maintain a certain ecosystem in the setting. For example, we've seen from the literature that glass, laminate, acrylic, all of them have very, very different ways in which humidity impacts them and the transmission of certain microorganisms on them. And you can find all of these details a lot more in the issue briefs. So we basically know that there is no specific formula for a certain solution to work because every pathogen reacts differently to different circumstances. There are some recommended standards for temperature, humidity, air change rate, ventilation, and pressurization in the 2018 FGI guidelines, which are meant for different spaces in the healthcare setting. And it is an operational challenge and responsibility to be able to maintain these environmental conditions for optimum results. But this alone is not sufficient. Cleaning surfaces becomes a very, very critical part of infection control. Some of the common approaches that are used in healthcare are manual cleaning, no-touch automated disinfection technologies, or self-disinfecting technologies, self-disinfecting surfaces. And this is a relatively new concept that is coming about. When we talk about manual cleaning specifically, it is accomplished by using chlorine-based infectants, hydrogen peroxide, disinfectants, quaternary ammonium components. Only products that are formulated according to the Environmental Protection Agency and the Food and Drug Administration guidance are generally cleared for use. However, the quality and standards of cleaning in a given environment may be compromised sometimes due to different factors like the choice of product used for cleaning, whether or not the staff caters to the manufacturer specifications, if they comply to them or not. Sometimes it's inaccessibility to the surfaces that are really tucked within, inadequate monitoring because of excessive crowd or need for a faster turnover in hospitals could be some of the reasons why manual cleaning becomes a little challenging. Sometimes even the choice of applicator that's used, for example, using a mop versus using a microfiber cloth can impact the efficacy of a disinfectant. High touch, it's generally preferred that high touch surfaces that are closer to the patients are cleaned at least 3 or 4 times, and generally in the morning, it's suggested to be beneficial. Next slide. So there are some modern no-touch disinfection technologies that involve the use of steam vapor, hydrogen peroxide vapor. There's ultraviolet or pulsed xenon that has been used a lot. They definitely reduce the challenges that accompany manual cleaning and disinfection. However, they cannot completely replace routine cleaning procedures. They're used best in terminal or discharge cleaning to reduce the workload on staff and limit their contact with reservoirs of infection. Some of them are designed to target only easily visible surfaces, and hidden surfaces do not get cleaned with some of these modern technologies. Additionally, some of them come up with these huge setups, and from a space planning perspective, designers need to accommodate for the equipment. Some of them have more decontamination times than the others. Some impact turnover times. These considerations of cost efficiency, dwelling times, CDC disinfection level, wiping protocols, and pre-cleaning requirements that go before using a no-touch disinfection technology are all mentioned in a separate tool that you will find with these issue briefs. Moving on to the next slide. Self-disinfecting surfaces are some of the latest and newest emerging technologies in the field. Coating or impregnating surfaces with heavy metals like silver, copper, or zinc is gaining a lot more popularity in the industry now. Not only hard surfaces, but even textiles can be impregnated or coated with heavy metals. But these do come with their own limitations as well. Some of them cause discoloration. Some of them are found to have environmental or human hazards. For example, the use of germicides like triclosan were really seemed to be really promising in the industry until it came under scrutiny for being a human or environmental hazard. The third type of thing that is emerging right now is altered topography, which borrows its concept from biology and basically mimics the skin of shark. These are some really upcoming technologies, but there is very limited research on this. There is no promising conclusion yet, and hence there is a need for a lot more research and studies to be done on the self-disinfecting surfaces. So what is the design implication of all of the knowledge that we have right now? Most of the hospital furniture is made up of a combination of materials and textiles with multiple seams, joints, which makes it very difficult to clean between surfaces. So each material might require a different disinfectant or a cleaning method, which adds on to the existing burden of the staff. Or sometimes if the staff does not comply to the recommendations by the manufacturer, it results to damage in the furniture. So it is really possible to reduce surface contamination by using flush surfaces and by selecting finishes that are smooth or non-porous, more durable, and are not easily damaged or scratched. Other than that, water-resistant materials, seam-sealed construction methods, and moisture-impervious surfaces should be selected for work and sink areas. When we're talking about choosing furniture and furnishings, the pore sizes of soft surfaces and fabrics need to be accounted for. We should try and avoid carpets in areas of high infection, like in ICUs or in ORs. Furniture that we select needs to be movable and should have at least a sufficient clearance of at least 6 inches to be able to clean underneath and behind, especially for some cleaning practices, like if you're using a UV decontamination process, all the furniture should be easily movable because they need to be away from the wall. The location of the surface and the frequency of touch and associated user behavior, all of these things that we just discussed are necessary to ensure a proper surface cleaning. When we're talking about cleaning practices, all of these need to be considered in conjunction with the design features. For example, if there is an on-site laundry facility to clean all of the soft surfaces, the designer needs to ensure that there are separate spaces for clean and dirty functions. I just spoke about how some of the no-touch devices need to have a clear line of sight to some of the critical surfaces, otherwise the ones that are tucked in do not get cleaned. So we need to have the location of the no-touch device predetermined to make sure that a major portion of the room gets cleaned. So there is a need right now to align these operational factors and the needs of the healthcare system with the built environment. If you move to the next slide. So this is a downloadable PDF that you have access to. It has most of the considerations like cost efficiency, the potential hazards, or what are the different cleaning requirements for all the different cleaning techniques that we have. And we have a comparative table to look across and see really what the healthcare facility wants and what is the need of the hour. So it's a pretty extensive checklist of all the characteristics of each cleaning approach that can be used. So what's the takeaway from all of this? The literature clearly suggests that it's not just one factor that can contribute to or control for infections in healthcare settings. Very clearly, there is a need to solve this problem by taking into account the people who are involved, their behaviors, operational aspects, and the built environment. The FGI guidelines require that the infection control risk assessment conducted throughout the design process, and that there is a need to bridge the gap between existing regulations, expectations, practices, the ever-evolving understanding of epidemiology of infections, and the emerging technologies. This involves actually going beyond the current structure of the infection prevention team. It cannot just be comprised of 4 or 5 members in the healthcare facility. It needs to account for architects, it needs to account for manufacturers and everybody at a very initial stage in the design process. Again, we have a small reference tool that jots down the responsibilities of various team members that need to be involved in this fight against infection. So there's a checklist that you can use when you want to put together an infection prevention team. So in conclusion, poor design and maintenance of surfaces. So this is a screenshot of the PDF of the infection prevention team. So poor design and maintenance of surfaces can increase the risk of transmission of infections. So optimal design, the use of novel and best practice technologies can definitely reduce the burden of microorganisms in the environment. And we need to take into account how the design might impact development of HAIs and how we as designers can influence human behaviors to decrease person-to-person transmission. Thank you so much. So it was me and Ellen Taylor who worked together on these issue briefs. So there are 2 issue briefs, part 1, part 2, and there are 3 little tools that go with it.
And in addition, we have the entire risk infection control toolbox, as well as the safety risk assessment toolkit, which looks specifically at really it serves as a discussion prompt to be used early in the design process with the multidisciplinary team to really guide the conversation and the questions that will help to mitigate infections in the built environment. So you really have some very impactful and wonderful tools to access. Does anyone have any questions? Rutali, thank you so much for your research and your work and for spending some time with us today.
Thank you so much for having me.
Do you have some questions at this point, if anyone has any questions? And if you would like to text the questions, you may do that, or you may, I believe you can unmute yourself. Is that true, Jill? And they unmute if they hover in the left-hand corner? They would like to ask a question?
Yes, they can unmute themselves.
Okay. So
over the microphone.
If anyone would care to take the opportunity to speak with Rutali very briefly here. you may do that. There's a lot to process, a lot to consider. It certainly is a complex problem and a pervasive problem, but it does seem that as an industry we're understanding more and more, and we're making some progress. I'm particularly interested in the shark skin type surfaces that perhaps will make a positive impact. Okay, so, Kirk Hamilton, hello Kirk, is asking where can we find the PDF? So that is part of the issue brief for Tali?
It's with, yeah, they come with the issue brief. So
okay.
The reference in the issue brief.
Excellent. So if you go to the topics menu on the website and look under topics and go to the infection prevention toolbox, the issue briefs will be listed there, and that's where you can access the PDF. And or you can, well, perhaps in our follow-up email after this event, we'll give you the link to that specific issue brief so that you can find the PDF. Any other questions? Thank you again, Rutali. So now
There's a question.
Yes.
I'm wondering if there's any research out there regarding indigo lighting as infection control.
I believe there is, it does complement some of the existing cleaning protocols, which is more of terminal cleaning, I think. So they're used for terminal cleaning, but there isn't too much research out there on indigo cleaning itself.
Okay, thank you. And of course, for anyone interested in doing that kind of research, let us know, and either the center can be of assistance or we can connect you with the appropriate person in the industry that can help you with that. All right. Well, as you're thinking through, if you watch the presentation, the recording of the presentation, or you read through the issue briefs and have additional questions, you can always contact me. My email address will be at the end of this presentation, and I'll be sure to get your question over to Rutali or Ellen or the appropriate person and get back to you. So thank you again, Rutali. And I will now transition over to taking a look at some of the resources. So I mentioned that we do have the infection control toolbox, and perhaps many of you have already explored some of the resources that are part of this toolbox. And again, there is that the menu on the website that says toolboxes or tools. And then when you go and look at that menu, you'll find the infection control toolbox. These issue briefs are the latest addition to that toolbox. So each toolbox has somewhere between 15 and 30 resources, and those resources are continually updated. And so our presentation today was really highlighting the new issue brief that has been added to the infection control toolbox. So this is a quick snapshot of those new issue briefs and tools. And I also want to mention, as a related resource on this topic, we recently had Andrea Hyde present on a webinar that, again, was offered at the HCD conference, Surfaces Matter, Evidence-Based Strategies for Safe and Sustainable Life Cycle Performance. This is a webinar you can find by looking under the events menu and then looking at webinars, where you'll find this listed as an on-demand webinar. Now the webinars, you will be able to, as I mentioned earlier, Affiliate Plus members will have access anytime. All other affiliate members, based on the membership that is meeting your needs, you will be able to have access to the webinar either through a 20% member discount, or we do offer the quarterly webinar week for members, where during that week you will be able to access all the webinars. for the week. And the next webinar week is in August 12th. And then, of course, in the knowledge repository, we're always adding new citations as well as key point summaries. And so you can see that there are currently, when we did a search narrowing down to HAI outcomes, there are more than 600 citations that you can explore and review, and 79 key point summaries on this topic, as well as 14 articles. So another resource that you can take a look at. So that concludes our Affiliate Connections call for today. Again, I thank you all so much for your time. I hope you're all having a wonderful summer. My email is up on the screen. Any questions at all, if you have any trouble finding anything that I have reviewed here on the webinar today, just email me and I'll be more than happy to assist. And if anyone has any additional questions at this time, just let me know. I'll stay here for just a moment. A lot to take in. A lot of
quick question for you, Lynn. Is there any continuing education credits available for this seminar?
Is that something that could be self-reported, Jill?
I just was asking the question. Usually for the American Institute of Architects, it's a little bit difficult. For EDAC, I don't know if for continuing education with EDAC.
Yes,
As far as I know, no. But I can check. If I find out otherwise, I will send out an email to everyone.
Great, excellent.
And who's asking? Who was talking?
This is Frank Jesse.
Hi, Frank. Okay, so here's my thought on that. For any of our on-demand webinars or live webinars, there's a form that you can access for those webinars, which will provide the AIA credit as well as the EDAC credit. This webinar isn't set up that way, but my belief that you should be able to self-report that, but we will do a little bit of research for you and we'll get back to you on that.
Thank you very much.
Yep, my pleasure. Thanks for being on the call. Any other questions? Well, I just want to say thank you again, Rutali, for joining the call and for the work on the issue brief.
Thank you so much for letting me present for the center, and thank you so much to all of the audience who logged in and patiently listened to what I was saying.
Yeah, and honestly, we always view this as a collaboration, and bringing together like-minded professionals is probably one of the most important things we do in the industry. So I do want to say thank you to everyone who joined us today. Thank you for the work that you do in the industry and for your interest in a very important subject.
Thank you.
Thank you, Rutali. That will conclude our call for today. Please do feel free to reach out, and I hope to see many of you at upcoming events. Have a wonderful day.